the brachial plexus. So we are going to look at the brachial plexus. Okay, so just an introductory or an introduction on the brachial plexus. So a brachial plexus basically is a network of nerve fibers that will be giving motor and sensory innervation to the upper limb, the muscles of the upper limb. So for us to be able to move our muscles, also feel some sensations that someone has touched you, or you want to move your arm, all those are carried out via these nerves that we are going to talk about. So these nerves are going to be originating from roots that are going to form the same network of nerve fibers that will be innervating the muscles of the upper limb. So these roots actually, we have roots from C5 up to T1. So these roots will be originating within this interval from the C5 to T1. So the brachial plexus basically involves, as we have talked about, roots. Then from the roots, it also gets to have what we call the trunk. Then from the trunk, we are going to have what we call the divisions. Then from the divisions, we are going to have the cords. Then now, lastly, from the cords, we are going to have branches. That's how the brachial plexus is. So first of all, we are going to be having the roots. Then the roots will give rise to the trunk. Then the trunk will give rise to the division. Then from the division, the divisions will give rise to the cords. And the cords there, then they are going to give branches. So on how to draw the whole brachial plexus, or to look at the structure of the brachial plexus. So as we have said, first of all, we have got roots. So we have got roots, and these roots, they are about 5. So we have got 5 roots. So we have 5 roots. So we have got C5, C6, C7, C8, and the T1. So the C5, C6, C7, C8, and the T1, these are the roots that forms up the whole network of the brachial plexus. So you're going to find that the C5 root and the C6 root, they are going to join and they are going to form a trunk. And this trunk that they are going to form, it is known as the superior trunk. It is known as the superior trunk. Then from there, the C7 does not join with any, it just goes as it is. Then as it goes as it is going to form what we call the middle trunk. So remember, we are having the roots, then the roots are giving rise to trunks. So from there, the C8 and the T1, these they also join, and as they join, they are going to form a trunk, and this trunk is known as the inferior trunk. So the C5 and the C6, they join together to form the superior trunk. Then the C7 just goes and forms the middle trunk. Then the C8 and the T1, they go and join together to form the inferior trunk. So from the inferior trunk, or rather from the trunk, we said that after the trunks, we get to have the divisions. So from the trunk, we are going to find that there will be now divisions that will start coming in. So we are going to have the anterior division as well as the posterior division that are going to be formed. So we're going to find that each trunk is going to form the anterior as well as the posterior division, and this one also form the posterior and the anterior division. So this division here, it is going to be known as the anterior division. Then this one is going to be the posterior division. Then for this one, we are going to have this one as the anterior division. This one here, let me try to use this one. So we are going to have this one here as the anterior division, and this one we are going to have here as anterior division for this one. Then the posterior division is going to be this side. This one is going to be the posterior division. Then for the other one, we are going to have the posterior division, which is going to be this one. This one is going to be the posterior division. Then the remaining one, which is going to be down here, is what is going to be the anterior division. So from the trunks, the trunks are going to be forming divisions. So divisions will be having two per trunk. We'll be having the anterior division, posterior division for the superior trunk, and also the anterior division, posterior division for the middle trunk. Then you're going to have the posterior division and the anterior division for the inferior trunk. Then from there, you're going to find that these divisions of the trunks are going to be now joining to form the chords, because right now we have now formed the division. So we are now going to start seeing how the chords are going to be formed. So the chords, how they are formed is that the division for these trunks are going to be joining together to form the chords. So you are going to find that the anterior division of the middle trunk and the superior trunk are going to join, and as they join, they are going to form what we call the lateral chord. So they are going to join here to form the lateral chord. That is for the anterior division of the superior and the middle trunk. Then from there, the inferior, or rather the posterior division of the same superior trunk and the posterior division of the middle trunk, together with the posterior division of the inferior trunk, are going to join, and they are going to form what we call the posterior chord. So you'll find that the lateral chord is formed by the anterior division of the superior trunk and the middle trunk. Then the posterior chord is going to be formed by the posterior division of all the three trunks. Then the medial chord is just going to be formed by the anterior trunk of the inferior, or rather the anterior division of the inferior trunk is what is going to go ahead and form what we call the medial chord. So at this point, you're going to find that the chords are already formed. So this is how the chords are formed. Then from there, you're going to find that now these chords, they now have to start dividing so that they can form branches. So now how they start dividing is that the lateral chord that we are seeing here is going to divide into two. So it is going to form the first branch, which is going to be known as the musculocutaneous branch or musculocutaneous nerve. Then from there, we are also going to find that the posterior chord here, it is also going to divide to give one branch, and this branch is going to be known as the axillary nerve, and it is also going to divide to form another branch that is going to be known as the radial nerve. So the posterior chord will give two branches. So it would give two branches. The first branch will be forming the axillary nerve, and the other branch will be the radial nerve. Then the first one, which is the lateral chord is dividing. Its first branch is giving the musculocutaneous nerve. And then what will be happening is that this medial chord that we are seeing down here, it is also going to divide into two branches. So the other branch is going to form what we call the ulnar nerve. Then you're going to find that one branch from the medial chord and the other branch from the lateral chord are going to come and they join together. And as they join together, they are going to form one nerve, which is known as the median nerve. They are going to form what we call the median nerve. So from there, you're going to find that you will be having these four main branches. So these are the four main branches that comes out from the brachial plexus. So you're going to find that these branches will be having the musculocutaneous branch, we'll be having also the axillary nerve as well as the medial nerve. We're also going to have the radial nerve and the ulnar nerve. So we're going to be having about 5 branches that are going to be coming off. So 1, 2, 3, 4, 5. So this is how the whole brachial plexus, the network of the nerves, comes out from the roots. getting onto the trunk, then forming the divisions, the cords, and the branches. So just to have a quick run through of the whole thing, we said that the roots of the brachial plexus, they are about 5, and they originate from C5 to T1. So we have got the C5, C6, C7, C8, and the T1. Then we said that the C5 and the C6, they join together to form the superior trunk, and this is the superior trunk that we formed at that point. Then from there, we're going to find that the C7 just goes straight on its own and forms the middle trunk. Then from there, we're going to find that the C8 and the T1, they are going to join together and form what we call the inferior trunk. So from the trunks, as the trunks are formed, now we are going to have the formation of the division, and we said that each trunk, it will divide into the anterior and posterior division. So the superior trunk divided into the anterior as well as the posterior trunk. The middle trunk also divided into the anterior and posterior trunk. Then the inferior trunk divided into the posterior as well as the anterior division rather. So these are divisions here. So then from there, we say that these divisions now, they start joining together so that they can form what we call the cords. And we said that the anterior division of the superior and the middle trunk, these anterior divisions, they are going to join together and form what we call the lateral cord. So the anterior division as well as another anterior division of the superior and the middle trunk, they are going to join together to form the lateral cord. Then from there, we are going to find that the anterior division of the inferior trunk, it just goes direct. It does not join with these others to form any cord. It just goes direct on its own and form the medial cord. Then from there, we said that the posterior cords of all the 3 trunks are going to join together and form what we call, or rather the posterior division of all these 3 trunks, they are going to join together and form what we call the posterior cord. And when this posterior cord is formed, the lateral cord is formed, and the medial cord are formed, they are now going to start giving off branches. So these branches that they are going to be giving off, tenuous nerve, and the second branch will join with the other branch from the medial cord to form the medial nerve. Then from there, we said that the posterior cord would divide to form the axillary nerve as well as the radial nerve. Then the other branch for the medial cord is going to form the ulnar nerve. So you're going to find that there's a mnemonic that they use, or that we use, if you want to remember nicely these nerves that are formed. And this mnemonic can only be used if you remember them in this same format of how the branches are divided. So the mnemonic is MAM. So we have got this type. So in this case, we are going to have MAMRU. So we are going to have the musculocutaneous nerve, the axillary nerve. We are also going to have the medial nerve, the radial nerve, as well as the ulnar nerve. So having talked about all this, this is how the whole brachial plexus network of nerves tends to come out. Yeah, so when you've been told to draw the brachial plexus, these are the things that you're expected to show in your diagram as you are drawing. Yeah, so there are also other minor branches that you can try to look at that will just give you a clue of where they originate from, like the subscapular, the lateral median, the lateral pectoral nerve, the medial pectoral nerve, the dorsoscapular nerve, the long thoracic nerves. Those nerves, they are minor branches that will be originating. Some will be originating from the cords, some from the trunks, and so on and so forth. But the main thing that you have to know about the brachial plexus in terms of you being taught to draw it, it is here, and that's how you draw the brachial plexus. Otherwise, thank you very much for your time. Have a blessed evening.